So let's take, for example, a cold infection. All right, so during a cold infection, when we're talking about the incubation period, at that time, we don't know that we have the infection yet. The virus, the cold virus is already infecting this or inside the body, and at that time, we don't know it's there, right? So it's trying to adjust, it's trying to infect cells, it's getting ready to divide, right? So these are the things that it is doing at that time. So no signs or symptoms. The prodromal period, you may have mild signs or symptoms. So if you have the cold infection, maybe you don't feel so well, and that feeling of that feeling that you don't feel well is called malaise, right? So malaise, I don't feel well. All right, so so that will be there, or maybe your throat is starting to scratch, right? Maybe you're feeling fatigue, right? Those are all going to be symptoms, right? And then period of illness, if you have a cold infection, congestion at this time, you have runny nose, you're sneezing, you're coughing, these are all going to be associated with the period of illness. And that's when the number of microbes are going to be at the most, so this corresponds with the log period. The period of decline, this is where now the number of microbes start to decline and there's not as many signs and symptoms. What may be some reasons for the decline in the microbe or the virus that is causing the disease? What may be some reasons that the microbe now is starting to die? Well, one, maybe your immune system now has caught up and it's now defending you, all right? Or maybe you're taking some sort of medication in order to help you to kill the microbe, all right? So these are some things that may cause the number of microbial particles to decline. And then during the cold infection, you have the period of convalescence. You may still have a few signs and symptoms at this time, but not as many. And there's still microorganisms present, so you can still, even at this period, you can still transmit the microorganisms to someone else. So there is a difference between symptoms and signs. So symptom is a change that is felt, right? This is something that you feel, right? Nobody else may be able to see, but you feel when you have a disease. But a sign is something that can be measured or observed as a result of a disease. All right. So what I gave you some examples of symptoms. What would can you think of any more examples of symptoms or examples of a sign? All right, so I gave you malaise, fatigue for symptoms. Maybe you have a headache. Right, so these are all going to be symptoms. What will be some signs? Fever. Right, this can be measured. All right, this can be measured and detected. Maybe changes in blood pressure. Swollen lymph nodes. All right, these are called buboes. So I'll give you the name here now. All right, so these will be 3 examples of signs. So if you're sick, you have disease, you go to the doctor's office, if you go there and say, oh, well, I don't feel well, all right, they're going to say, well, let me check to see if there's a fever, let me check to see if there's changing, let me check to see swollen lymph nodes. And if they don't see certain signs that correspond with your fatigue or your symptoms of not feeling well or headache, or maybe even your stomach hurts, right? They want to see some sort of sign. And when the doctor or clinical staff can match your sign with that symptom that you have, right, then they know that something is wrong, and then they should proceed with further tests. But if you just go to the doctor, I don't feel well, they're probably just going to send you home. So next we'll talk about disease transmission, right? So there's different ways diseases can get to you, and we call this transmission of disease. And the first three that we'll look at will be contact transmission. So the first one, direct contact, where someone has to come into direct physical contact with you, touching, right? In this case, we see it here in the picture, there's hugging, has to be kissing, handshake, right? Sex, all right? These are all different ways that microorganisms can be transmitted through direct contact, all right? So I gave some examples of STDs, then you have the cold, flu, and cough. The second example of contact transmission, we have indirect contact, and these are spread by fomites, all right? So our picture is here, all right? So what do we mean by fomite? What does that mean? You probably read this in the book. This means an inanimate object, right? So what are examples of the inanimate object? Well, I put here the needle and tissue, and these are inanimate objects where the microbe that's causing the disease, they can survive on for a period of time. And if you touch it, right, if you touch the infected tissue or the contaminated tissue or contaminated needle punctures you, you can get the disease. All right, so here in figure C, they're showing you an area of a person that probably has the cold or flu, right? And let's say if this is one of your loved ones that is sick, you're going to kindly go over and start cleaning up and helping them to clean up because you know that they're not well. But in the meantime, while you're touching all their contaminated fomites, right, you can get infected. Droplet transmission is where the microbe causing the disease is going to be transmitted through airborne droplets, as shown in this exaggerated figure D. The droplets of saliva and mucus, when they leave in a cough, a sneeze, or they leave when you're talking, right, they can infect another individual, right? So these microbes can go on to infect somebody else. And the spread is usually less than 3 feet, right? So the closer you are to that person that has the disease, the greater chance it is for you to be infected, right? Notice that in all examples of contact transmission, the cold, the flu, the cough is transmitted, right? Very easy to transmit those. And those are infections that are high throughout every year. Right? When we're talking about vehicle transmission, in this case, the spread of infection is greater than 3 feet, all right? So the transmission, the spread is greater than 3 feet, right? So it can infect many people as long as they come into contact with the source. And what's the source? The microbe that's causing the disease. So the first example, we have the disease of cholera, right? So this girl, she's drinking this contaminated water. It has the microbe that is causing cholera. What is that microbe? The microbe, we learned, Vibrio cholerae. All right, so she's drinking this source. If she drinks this source, she gets contaminated. Somebody else comes and drinks from the same water, they can get contaminated. Whoever else drinks from this water will get contaminated. So the number of people that come into contact with this water, right, they have a chance of getting infected. Our next is going to be salmonellosis. So this is our example here in figure B, right? Let's say this person is preparing food for a party or for a buffet, right? Whoever comes into contact with this chicken that is contaminated with salmonella is likely to get infected, right? So whoever eats the contaminated source, right, could be many people, again, a large number of people going to eat this food, they will get contaminated. And then in C, which is the last one, they're showing you dust leaving this garbage disposal truck, and whatever dust is leaving will carry microbes. And when you come into contact with this, you can be greater than 3 feet away from the dust, you can get infected, right? So these are, again, transmission by food, water, air. Those are the vehicles. Those are the route in which they will get transmitted to their host. In our last example of transmission, last two examples, we have vectors. And vectors, we're talking about an arthropod. What do we mean by arthropod? An insect, right? So these will carry the microbe to the host in some way, right? So either they can carry it through mechanical transmission, which is indirect, and then we have biological transmission, which is direct, right? So what do we mean by indirect versus direct? Well, in the case of indirect, the insect, the arthropod, doesn't come into contact with us. Instead, it comes into contact with the fomite, and then we touch the fomite. So to give an example here, this fly, let's say if the fly is carrying Shigella, the fly will deposit the rod-shaped Shigella onto the food source, and then what will happen, we will eat the fomite, right? We eat the burger or hot dog, whatever this is, we eat it, but it already has all of the bacteria, right? So again, the fly doesn't come into contact with us, but it comes into contact with the fomite, which is the food that we are looking at here. And then we eat the bacteria, so we get sick, right? So we'll get the symptoms of shigellosis. All right. Biological transmission now, this will be when the insect, the arthropod, touches us, and then they directly transmit the organism to us. All right. So the example that we have here is going to be malaria, and in the case of malaria, the mosquito here is going to transmit the infection to us. All right, do you remember what the name of the mosquito is? You need to know it. All right, so the name of the mosquito, we have Anopheles. All right, so this is going to be in chapter 12, right? So chapter 12, this is where we discuss malaria for the first time. All right, you also have the handout on protozoa. You need to go over this organism. This will be a good time while you're reviewing the slides, go back. And then Lyme disease, which is caused by Borrelia burgdorferi, right, is transmitted to humans by a tick. All right, and what is the tick's name? This was in chapter 11. The tick's name is Izotes, right? And you need to review. So at this time, it would be a good time to review many of the organisms in chapter 11 and chapter 12, so that way you can go over organisms like Shigella and Borrelia, which is in chapter 11, and then chapter 12, which has protozoa and many other eukaryotic organisms. So last in chapter 14 would be the nosocomial infections. And nosocomial infections are acquired during a hospital stay, right? So these are also known as hospital-acquired infections. So to give an example, if you have a stroke, you're in the hospital because you have the stroke, but while there for, let's say, 12 or 15 days in the hospital, you get pneumonia. Right, so pneumonia would be the nosocomial infection. You acquired it while you were in the hospital. This affects 1 in 25 hospital patients and even kills many people, right? So remember, when you come into the hospital, when you're admitted to the hospital, you were already sick. Your immune system is already weak, and then you get sick again with something else. So this is going to be very devastating to your immune system. So there are 3 factors required for a nosocomial infection to commence. So number 1, you have to be in the hospital. Right? If you're not in a hospital, if you're not admitted to a hospital, it's not nosocomial infection. Number 2, you have to be compromised. Right? So you can't be the visitor of a patient or the volunteer or the worker that's healthy. Right? You have to be compromised. So the patient. And the third one is the chain of transmission, right? There has to be a way for the microorganism to get to you. And either the microorganism is already on your skin and will invade you, right? One of your normal microbiota, or it can be the microorganisms from the staff, which are healthy, right? So those organisms which wouldn't really cause harm to the staff can now can now be very problematic to a weakened host. So in this picture, we see here the clinical staff. They're wearing coverings for the head, mask. They're wearing gowns, gloves, and these items are not just protecting the staff, but it's also protecting the compromised host, the patient that is sick, right? So that way, microorganisms that normally would be with the healthy person will not infect the compromised host. Gram-positive organisms are going to be the major cause of nosocomial infections, and these include our epidermis and aureus that are found on the skin and can be transmitted from the hospital workers to patients, or can even be part of the normal microbiota, but can now have the opportunity to invade these compromised hosts. All right, so a large number of these infections are caused by Staphylococcus epidermis, 25%, and Staphylococcus aureus, which of course makes up a smaller population of organisms compared to epidermis. These are coagulase positive, right? And they cause a lower number of these nosocomial infections. For gram-negative organisms, they also can cause nosocomial infections. These include your enterics, Pseudomonas burkholderia. Again, you need to go to chapter 11 to review these characteristics of the organisms, what they look like, what class they're found in, if they're gamma, delta, epsilon, alpha, beta, proteobacteria. You would need to know what they are. The three most common sites of these nosocomial infections: number one, the urinary site. All right. For many of these patients that are in the hospital, they may be incontinent, have incontinence. They may have some sort of Foley catheter that they have. Maybe they're not able to go to the bathroom without assistance. So again, the urinary tract can get infected by many organisms, and usually it's the gram-negative organisms that will infect the urinary site of these patients. So it's very important that the hospital staff, if there's some sort of Foley catheter, that the hospital staff checks the Foley staff catheter, making sure that it's clean, and also if the patient needs to get to the bathroom, that they're helping the patient get to the bathroom, and managing their patient well, right? So the urinary site, about 40% of the nosocomial infections, number one. Number two would be the surgical site, right? So certain areas of the body are open, right? Once they're open, they're going to be more prone to infection, all right? 20% of the nosocomial infection. So this is the second most common. And if a person has surgery, again, it's important for the staff to maintain the surgical site, right? If they have to change any gauges periodically, if they have to clean the site periodically, all right? They need to do that in order to keep the site clean so that way it won't get infected. And then the third most common site will be lower respiratory tract infections such as pneumonia, 15%. So you just need to know the three most common for your exam. And the lower respiratory tract infections can be caused by many different organisms, especially in these immune-compromised individuals.